Hi, I'm Karol. Melipona Stingless Bee Raw Honey has a distinctive flavor and sour taste compared to Apis mellifera honey. Currently, interest in farming Melipona stingless bees is growing among rural residents to meet the high demand for raw honey and honey-based products. Several studies on Melipona Stingless Bee Raw Honey have revealed various therapeutic properties for wound healing applications. These include antioxidant, antibacterial, anti-inflammatory, and moisturizing properties related to wound healing. The development of Melipona Bee Raw Honey for wound healing applications, such as incorporation into hydrogels, has attracted researchers worldwide. As a result, the effectiveness of Melipona Bee Raw Honey against wound infections can be improved in the future to optimize healing rates. This paper reviewed the physicochemical and therapeutic properties of stingless bee honey and its efficacy in treating wound infection, as well as the incorporation of Melipona Stingless Bee Raw Honey into hydrogels for optimized wound dressing. Wound healing is one of the most challenging physical processes and requires a great deal of attention. Hemostasis, inflammation, proliferation, and maturation are all phases of wound healing physiology. In the first phase, hemostasis, the platelets and fibrin clump together to form a thrombus, plugging broken blood arteries and preventing blood loss. The inflammatory phase then begins, during which a large number of neutrophils and macrophages enter the wound area to engulf and destroy bacteria, pathogens, or debris via the phagocytosis process. During the proliferation phase, angiogenesis begins, and granulation tissue is produced to replace injured tissue. This is followed by the maturation phase, which begins 3 weeks after the injury event and lasts more than a year. The wound area becomes rich in collagen and other extracellular matrix deposition (ECM) proteins over time. Non-healing wounds, on the other hand, are wounds that do not heal in a timely and orderly manner and can cost up to $50 billion in the United States alone, while scars from surgical incisions and trauma cost roughly $12 billion, and burns cost $7.5 billion in healthcare each year. Clinical trials have shown that the dressing must continue to function as a temporary barrier to prevent infection and fluid loss. Hydrogel technology, which recognizes the significance of the wound healing process, offers suitable products for biomedical applications, particularly in wound healing. Hydrogels are recommended for wounds that are dry to mildly exuding. They have a noticeable cooling and soothing effect on the skin and are beneficial for burns and painful wounds. They are also effective in softening necrotic tissue on the wound surface and hydrating wound surfaces. They can be used or removed without interfering with the wound bed, and they are non-adherent. Melipona Stingless Bee Raw Honey has been shown to have therapeutic properties, such as antioxidant, antibacterial, and anti-inflammatory properties, and is a natural moisturizer for wound healing applications. It has the potential to be commercialized in the pharmaceutical industry. The high number of polyphenol compounds in Melipona Stingless Bee Raw Honey means it is good at promoting cell proliferation, protecting the cellular structure, and fighting against free radicals in the wounded area. For further information, please visit our secure websites. Thanks.